everybody. My name is Aaliyah Brockbank, and I am the Practice Development Manager of Sinclair North America. Thank you so much for joining us this evening. Really appreciate it. Tonight, we have an absolutely incredible physician joining us to speak on the EnerJet, and that is Dr. Teny Haroutunian. She and her practice are located in La Cañada, California, and her practice is called Renewology Med Spa. Absolutely stunning. I definitely need to make it back there. But she really has a huge focus on regenerative aesthetic medicine. And that's, really where we've seen the industry going and will continue to go, right? So it really is perfect that she's speaking on EnerJet tonight because aesthetic regenerative medicine and EnerJet really do go hand in hand. So I'm really excited to hear her her insights and her outlook and just her information on the EnerJet. Any questions we can absolutely hold at the end. So with that being said, Dr. Teny, thank you for joining us. And I'm going to share my screen.
Hi, everyone. I'm Dr. Teny Haroutunian. Thank you so much, Aaliyah, for the introduction. Yes. And thank you, Sinclair, for having me on today to talk about the EnerJet. I'm gonna begin by introducing myself one more time. I mean, Aaliyah said everything that needed to be said, but I'm a physician. I'm a board-certified physician. I have a practice in La Cañada, California. Our practice does focus mainly on regenerative aesthetics and wellness. And I've had the EnerJet platform for about 3 years now. When we initially bought the platform, I have to say it was a bit of a leap of faith for us because at the time when we started looking into it, we realized there weren't that many clinics within the United States that were using it. And if I'm not mistaken, we were going to be, if not the first, one of the first clinics on the West Coast that was going to bring it on. And but then I really started looking into it, and I realized that this is a platform that has been used for years in pretty much most of the other continents, and the results that patients were getting were truly astounding. So we really jumped in, and we're very happy that we did so. So let's talk about what the EnerJet is, first of all. So should we move on to the next slide? Okay, perfect. So, is this the first slide? Okay. So EnerJet, let's talk about what it is first. EnerJet is a very versatile platform. Okay, it is very revolutionary in that it uses kinetic energy in the form of jet pressure to deliver a specific active compound directly into the skin. And it does this without the use of needles, and it does this in a very controlled manner. And the reason why it's so fantastic is because EnerJet is FDA approved for this specific indication. But in addition to that, it has a lot of synergistic effects, right? It has a secondary benefit to it. And the secondary benefit is regenerative in its action, because as you're delivering these compounds, the strong jet pressure is actually activating the entire regenerative cascade. And we'll totally dive more into it as we go along. So this first slide really talks about all of the applications of the EnerJet. EnerJet is very versatile, as we mentioned. And you can see here that you can do a kinetic facelift with EnerJet. And this is the one that's really going to be the one that your patients are gonna go for. They're very excited. They hear about the kinetic facelift and like, oh, what is this? So no pun intended, but this is going to be the one that's going to raise some eyebrows. The next a few treatments that you can do really involve scars, and we're talking about all kinds of scars. So you're gonna be able to treat acne scars, whether they're rolling scars, box scar, ice pick. It's fantastic for treating acne scars. You can treat keloid scars, and honestly, when it comes to keloid scars, EnerJet truly is a game changer, and we're gonna get into that in a little bit too. You can treat hypertrophic, post-surgical scars. You can also use it for dermal thickening and to treat fine lines and wrinkles. So I mean, these usually go hand in hand, but as you can see, it's a very nice versatile platform. So you can go on to the next slide, please. Okay, so this is what we were talking about before in terms of what is EnerJet. Again, it's FDA approved for this subdermal delivery for therapeutic agents, and it uses this jet technology. It creates that micro trauma that we were talking about, and of course, it is regenerative in action. So we kind of went over all of this before. Next slide. Okay, so how does it actually work? So it uses this high velocity jet stream. The high velocity jet stream creates this little, really, really tiny opening in the skin. It's 200 microns. And through this, it delivers the active compound in the form of a blast. So the active compound goes in, you have all of these, the compound pretty much disperses up to about 1 centimeter within the skin, and it can go, you know, it can stay superficial if you want it to stay superficial. It can go deep if you want it to go a little bit deeper, but it's a wonderful way to deliver this active compound in a very homogeneous way under the skin. Next slide will show a little bit more. Okay, there you go. So here it's showing you how it creates these little tiny nanoparticles are pretty much spreading out as you are delivering the active compound. Same thing as spreading out about 1 centimeter wide. It can go down to 6 millimeters deep, and it's very uniform treatment, okay? Now, on the bottom slide, you can see how this is a fibroblast, so you can see how this trauma has activated the entire cascade that has to do with regeneration, and it activates the fibroblasts, which then, of course, now go into the whole repair mechanism mode. And the fibroblasts then start depositing the collagen, the elastin, and they remodel the tissues for these long lasting results. Next slide. And this is a video that shows everything. So here's the blast happening. As the blast happens, the skin forms this little tiny papule, which usually will last a couple of hours. But there you go. So you have these little fibroblasts swimming and depositing that new collagen and elastin that's going to give you that good skin trigger. Okay, now in this slide you can see sort of the same concept. This is the active compound being delivered in a gel medium, and you can see how well it's spreading out. So this is everything that we were talking about just now. So very nice homogeneous spread, spreading deep, spreading wide, and spreading very evenly. Okay, when we're talking about controlled depth, right? There was, in the previous slide, it said, there was a little bullet point that said that this is very controlled depth. And what we mean with controlled penetration depth is that you know, this is a tunable device, meaning that you can actually decide how much pressure you're using in depositing this agent, right? Because, you know, sometimes you want to deposit the actual active compound a little more superficially. Sometimes you want to go deep, right? Sometimes you're treating a keloid scar that's very fibrous, very dense, and sometimes you're treating the skin on the neck, which is very soft and very you don't want to be too aggressive with that. So if you're going up on the pressure, you're going deeper and a little bit more aggressive. If you're treating, say, for example, crow's feet or the neck, then you're going very low on pressure. You're keeping your pressure, let's say 25%, and you're being a lot more gentle with the treatment. So it's a very tunable platform. Okay, next. Here we're talking about that synergistic effect that we're talking about, right? So the first effect is the fact that you're delivering the agent into the skin. The second is the secondary gain that you're getting from this microtrauma. When it comes to regenerative medicine and regenerative aesthetics, everything is about creating tiny amounts of controlled trauma, doing it in a very fractionated way and allowing the skin to heal. And it's the healing process really that's then increasing the amount of collagen and elastin that you have in the skin and making you look so much better. So all of this is part of the cascade of regeneration. So let's go on to the next slide. Okay, this is a great graph, and it's showing you when you're doing an EnerJet treatment, you're getting an immediate effect. Okay, so the minute you do the treatment, as a matter of fact, when I'm doing a treatment on a patient, let's say if I'm doing a kinetic facelift, I sometimes will treat one side of the face, and I have the patient sit up, and I kind of show them one side versus the other, and they can see the immediate effects, right? This is a Cinderella effect. The immediate effect is happening because you're depositing this hyperdilute filler. We'll talk about the treatment a little bit more in a bit, but you're depositing this hyperdilute filler, so you're creating a little bit of that fullness, and that's causing this immediate lifted look. So that's the Cinderella effect. It's going to last you for a short period of time. After a couple of days, that's going to go away. Then you have the activation of the entire cascade that we were talking about. You have the hydration of the skin. You have the stimulation of the collagen and the elastin. And over the course of really most of the time when I talk to patients, I tell them that anything regenerative is pretty much going to begin at the 3-week mark, and it's going to continue to improve over the course of the next 6 months. So within those first few weeks and before they come back for their next appointment, usually you're already seeing some of those effects starting to come in. But it's nice for the patients to see the immediate effect, that Cinderella effect, because they know what to expect when all of those results start coming in. Finally, you also have a continuous effect, right? This is the progressively improving effect that you're getting just from all of that microtrauma, from the proliferation of your fibroblasts, from the remodeling of the skin, from the more reorganized collagen, from the increase in the glycans that you have in your skin. So all of these things are going to continue to improve, and they're going to last the patient. Typically, patients always ask me, okay, I'm doing these things, how long is this going to last me? And I usually say, you could expect at the very least a year, sometimes a year and a half, sometimes 2 years. It really depends. We're never stopping the aging process, is what I always tell patients. You're still going to continue to age, but what you're doing is you're boosting yourself. And eventually, you're going to notice that that curve starts sort of coming down, and it's time to do another treatment to sort of get another boost. Okay, next slide. Okay, this is a great slide. And give me 1 second. See what I'm seeing here. Okay, this is a great slide. You can see the histologic effects here in these slides. And what this is basically showing you is that, first of all, you practically see minimal damage to the epidermis, almost no damage to the epidermis. You're seeing very homogeneous spread of the product in the dermis directly, and you're also seeing how there's practically no injury to the blood vessels or to any of the structures around it. So you're essentially treating what you want to treat, leaving everything else intact, which is, fantastic. All right, next. Okay, what are the applications of EnerJet? Okay, we have the kinetic facelift. I love the kinetic facelift. It is a great treatment. So how do we do this? Usually when I explain this to patients, I always tell them, I know it's called a kinetic facelift. It's not a facelift because really nothing's going to be a facelift other than surgery, right? It's not going to reposition your tissues. What you're getting from the kinetic facelift is you're getting a little bit of augmentation in the right areas, and you're minimizing this movement that you have in the skin. Sorry. So what you're doing is you're getting a little bit of that volumization, and you're really changing the vectors in the face. So as we age, we start noticing that our vectors sort of start going down. We look more like your typical triangles, and what you're trying to do when you're trying to anti-age or you're trying to improve, your aesthetics, you're really trying to turn that triangle upside down, right? So you're trying to move your vectors and have them go upward. And that's what you're seeing with the kinetic facelift. The other thing that patients should expect is, I always tell them that they'll just look more rusted. Their eyes will appear more open. Their brows will be lifted just in the right places, and I'll tell them that people will actually comment, and people do comment, and they'll say, "Oh, you look so good." I had one done, and I remember I had nothing else done. I went to a party, and everyone's like, "What did you do? You look so good." Even though I didn't look significantly different, but I just looked rested. I looked a lot better. I looked a lot more lifted, and just it got improvements in my nasolabial folds, and it just was a fantastic treatment. Now, the picture on the right is telling you how we would normally treat a patient when we're doing a kinetic facelift. This is an example. It's a very good guide to go by, but you always have to remember that not all patients are treated exactly the same way. You have to make your own assessments. And what I usually like to do is I have patients sit up, I look and I move the skin around to see where they have most laxity. I make little tiny diagrams, and I put little arrows to know exactly where I'm going to be treating. And I really try to treat along those lines to really get the effects that I want to get. And but these are the basic areas where you would normally treat when you're doing kinetic facelift. It's great when you're going along the mandibular line. You really can define the jawline very nicely this way. You take it along the hairline, you go behind the ear, and for the most part, this has very minimal downtime. The kinetic facelift, really EnerJet in general, the downtime, if you're going directly over the face, like if you're treating the cheeks or you're treating the neck, the downtime definitely can be a little bit more intense. So it can be there. You can have little papules there for 24 hours maybe, and then it settles down. You have little tiny dots that then slough off. Eventually, that process typically takes about 7 days. But when you're talking about a kinetic facelift, most of these little papules are going to be in the hairline, so they're going to be hidden, and patients walk out looking perfectly fine, and there's practically no downtime. I tell them to just go ahead and wash their hair the next day the way they normally would, and they usually all do very, very well. When I'm explaining how it's going to feel for the patients, I typically tell them that there's no pain. I don't numb when I'm doing this procedure. I actually don't numb at all with EnerJet. I've never had to. I typically tell patients that it kind of, the platform itself works just like a Nerf gun. I don't know if any of you have children, and if you have boys, you've probably been ambushed at some point in your own household, and you felt what an actual foam bullet feels like when it's fired from a Nerf gun. That is essentially what it feels like. So you essentially feel kind of like a little flick, sometimes a little bit of a burning sensation afterwards, but really doesn't hurt any more than that. But it does have a very loud noise, so typically I'll fire a few times just so the patient can hear it. You have to prime your gun anyways, and at least this way the patients know exactly what to expect. And then we go ahead and we treat as we had discussed. So it's a fantastic treatment. It has minimal downtime, and patients generally love it. Usually when you're doing a kinetic facelift, you are doing a series of 3 treatments, and you're spacing your treatments about 1 month apart. It depends, when they're younger, I like to space them about a month apart. If they're a little bit older, I sometimes might want to give them a little bit extra time to recover, and sometimes I'll spread it, 6 weeks or even 2 months apart. Next slide. Okay, so here you can see, this is actually from our practice. You can see how you can reduce the laxity. So at the top, this is the patient before the treatment, and you can see how when I'm pulling back, there's quite a bit of laxity in the skin, versus in the bottom one, we're pulling up and there's hardly any laxity there. And you can see what the papules look like. I mean, this is honestly, this treatment, this is probably about 15 minutes after I did the treatment. You can see those papules have pretty much gone away, and all you're left with is just a little tiny pinpoint entry point. Okay, next slide. All right, so here, this is also one of my favorite treatments to do. This is actually really fun to do too. This is treatment of necklines, and with this, oh, by the way, in terms of what you're using as the actual compound that you're putting in the skin for the kinetic facelift, you're using dermal filler. And what you're doing is you're using 1 part filler and you are using 9 parts bacteriostatic saline. So you end up with 10 cc's of fluid. 1 cc is going to be your hyaluronic acid filler, and the other 9 cc's are going to be the bacteriostatic saline. What type of filler you use really depends on what you're trying to treat. When I'm doing the kinetic facelift, I use something that's got a slightly higher G prime, like a Restylane Define. If I'm doing, these correction of the neck lines, then I'm using something that's a little bit lower G prime. And in this case, I would use like a Restylane Refine or a Bellotero would be a good filler to use. So we can go on to the next slide. And here you go. This is a patient in our clinic, and that's how I do the treatment of the necklines. So really fun to do. These little papules resolve. I tell patients that they're going to look like they have measles for a couple of hours, and then after that, it's going to be all fine. That's it. And then once the papules settle, you know, those little tiny red dots within about 48 hours to 72 hours, they become little tiny scabs, and eventually over time they slough off. As a rule of thumb, I always tell patients that the face obviously heals a lot faster, your skin cell turnover is a lot faster there, so usually your downtime expected should be about 7 days. Anything to do with the body, that downtime can definitely be expected to extend a little bit longer, sometimes, you know, even up to 3 weeks. Okay, next slide. All right, so this is the treatment of scars. So here you're seeing, one second. Sorry. So when we're talking about scar tissue, what is scar tissue? So scar tissue is tissue that's sort of being held down by these fibrous tethers, right? These fibrous bands that attach themselves to the subcutaneous tissue. In the past, when I've treated scar tissue, usually I've had to do some subcision. So usually I take a cannula and I go in and I manually subcise and I try to break down these fibrous bands. And then I've gone over it then with either microneedling or a radio frequency microneedling device to try to then, you know, get that activation of that regenerative cascade, right? With EnerJet, you don't have to do that because this one machine does everything for you. You get liquid subcision. So as you put your EnerJet tip on and you fire, you're actually breaking down these fibrous tethers, and it's the pressure that's breaking down the fibrous tethers. So you immediately notice the scar kind of raising up. And then in addition to that, of course, you're depositing the volume in there. So that's also going to help lift up the scar. Sometimes I'll go back on the same scar if it's very indented. I'll go back and I'll do a couple right in there just to lift it up as much as I can. I add more volume, create a little bit more of that trauma to try to get the whole tissue to reorganize itself. So you're de-anchoring, and then eventually you get this tissue regeneration that happens from the inside out. Next slide. Okay, this is a patient who actually came to us from Northern California because she heard about the EnerJet. And she is super happy with her treatment. She had a ski accident and had to have surgery, and she really, really dislikes her scars. So this is a treatment that we're doing on her. And as you can see, the blast is going down. First I go directly on the scar, and then I go back and I do a couple of rows right next to it because you really want to reorganize that entire tissue. For this, I also use hyaluronic acid filler along with that bacteriostatic saline. I actually used a soft filler for this. So I think I used, Velotero for this treatment. All right, next. Okay, this is that same patient. This is after one treatment. And you can see already after one treatment, she wasn't able to come to us at the 1 month mark. So she came back. Well, we did it at the 1 month mark. At the 2nd month mark, when she came back, this is before we did her second treatment. And you can see how much of an improvement there is just with a single treatment. And she's already had 2. She called us the other day. She was super happy. She can't wait to come and have the 3rd one. And now she wants to have a 4th. So we'll see how it goes. Next slide. Okay, when it comes to keloids, the EnerJet is an absolute game changer. I don't think, I don't know if you've treated keloids in the past, but keloids are really, really difficult to treat. The entire mechanism of action and how people get keloids is really, there's a lot of inflammation, there's too much fibrous tissue, there's too much of this like disorganized collagen in there, and it creates this really this raised keloid that's very uncomfortable for patients. It's painful, it's itchy, and typically in the past when we've needed to have it treated, we have to inject keloids, and we typically will inject it with either Kenalog. Some people use 5-FU. And if you've ever had to inject a keloid, it's very, very, very difficult to inject because there's so much tension within the keloid. There's so much fibrosis in there. There's so much tension that as you're putting your needle in there and you're pushing, it truly, truly is very difficult to push that liquid through. Sometimes it's been so difficult that it's actually separated my needle from the head of the syringe. And really, it's extremely painful for patients. So with EnerJet, you've completely changed the game because it is a painless procedure. Believe it or not, I mean, patients can't believe it, especially most of the patients who come here have had keloids injected in the past, and now they're, comparing it to what it feels like with the EnerJet, and they don't even flinch. They're like, this is incredible. This doesn't hurt at all. So with EnerJet, you're now this time what you're actually putting in there is Kenalog, and you're pushing that that Kenalog in with that jet pressure. As the pressure is going in, it's actually breaking down the keloid scar, and of course the Kenalog itself is acting as an anti-inflammatory and is slowly causing that resorption of tissue in that area. Okay. Next slide. Okay, and this is what we were talking about in terms of the difference between the two when you're doing your needle injections. It's very physically challenging, both to you and also very painful for the patient. You also don't have very homogeneous distribution of the compound, right? Because you're injecting it and you have to do multiple injection points, and you have to go all around to try to really break up this keloid. So it's a difficult thing to do. Versus with the EnerJet, I think, Leah, if you click one more time, I think the picture comes up on the slide. There you go. With the EnerJet, it's painless, it's very fast, you have very precise treatment. The jet pressure, you do have to adjust the pressure, and this is how you know how difficult it is to get into these keloids. So like I was saying, typically if I'm treating somebody's neck for their neck lines, I'm using like maybe a pressure of 25, maybe 30 at most. When I'm injecting keloids, I had a patient the other day with a very large keloid, and we went up to 45 and it was bouncing right back. Nothing was penetrating the keloid. I had to go up to 55, 60, 65. I think I ended up treating this patient at 70, and it was quite intense, but we finally got the liquid to penetrate the keloid. All right, next. All right, this is what it looks like when you're doing a treatment. So immediately after, you have this little papule that forms. Within a couple of hours at most, really. On the face, again, it takes a little bit longer. Over the scalp, when you're doing that kinetic facelift, really 15 minutes and those things are gone. And then what you're left with is that little tiny pinpoint entry point, which is only 200 microns in size. And finally, after a period of time, anywhere between 4 and 7 days, that really scabs over and it sloughs off. Next. Yep, here we go. That's what the downtime pretty much looks like. It can look like what you see in the third slide for really up to about 4 days. But usually by day 6, 7, it looks much better. Obviously, I mean, you can use EnerJet in all skin types, but you of course have to be very careful, make sure that patients are not going under the sun, you know, especially those patients who have a higher tendency of hyperpigmentation. You really want to make sure that you advise them properly and tell them that they have to be very cautious, not go under the sun, because of course they can hyperpigment if this happens. But EnerJet is a very, very, very safe platform to use on all skin types. Next. One more. Okay, this is a nice slide, and this is what we're talking about with the tunability, right? So we're showing you here different pressures and what you expect to see with the spread of the compound. So at low pressure, you're noticing that the depth of penetration is so much more superficial, and it's pretty much staying right in that dermis. With the medium depth, you're going into the dermis, a little bit more into the subcutaneous tissue. With the 65%, you're really going deep into that adipose tissue. In the case of the keloid, like I said, I did have to go at 65% just to have it sort of penetrate that you know, fibrous tissue. Next. Okay, this is a great slide. I mean, this is pretty self-explanatory. I don't think it needs me to talk about this, but you can see how in the on the right side, how much more, how much younger that collagen looks, right? You're looking at that collagen synthesis. You're seeing how beautiful that dermis looks compared to the left. And how much of that regenerative action you're seeing there. In the second slide, the blue one, you're looking at the amount of glycosaminoglycans in the skin. Glycosaminoglycans, or GAGs, are specific carbohydrates. They're found in the skin and the matrix, and actually they provide the structure on which that collagen, that elastin is going to grow. And this is what gives your skin its nice turgor. You know, you have to have this in there for your collagen elastin to be able to even bind properly. So you're seeing an increase in these GAGs. In the third slide, you're seeing a beautiful migration of those fibroblasts to that area, and the deposition of the collagen. So great slide. Next. Okay, so this is showing you a kinetic facelift. And what you're looking at here, first of all, I want you to see how incredibly natural this is, okay? So this is a very natural treatment. You're not gonna look different than yourself. You're just gonna look a little bit refreshed. This is what I tell patients. So you notice that the edge of the brow is slightly lifted. You notice that there's more of the white in the eye showing. Your eyelids typically tend to lift really nicely. You have a decrease in the depth and the heaviness of the nasolabial folds. And you really have some nice contouring of the jawline happening here too. So, okay, next. This is a dermal thickening study. I don't know what this box is on the right. I can't really see what's going on here. Let's see. So in this study, basically it's telling you, you can see it's the décolleté in a patient, and this patient was treated, there you go, much better. This patient was treated 3 times at, again, 4-week intervals. And at the bottom, what you're seeing is, if you remember that graph that we were seeing originally with, you know, your immediate results and then your results after 6 months and then your results after a year, that's what you're seeing here. So at the pink bar that you're seeing is really that regenerative action as it's setting in, and that yellow bar that you're seeing is how the patient's looking really 6 months to a year later. And so these are your improvements. Next. And in the keloid scar study, the most important thing is that patients are really seeing a decrease in pain and pruritus. Honestly, when I've treated keloids, patients have said that they notice the results almost immediately in terms of improvements in just the pain and the pruritus that they have. You do have to treat keloids probably in multiple sessions. Depends on the size of the keloid. Sometimes one will be enough if it's really, really small. But usually when you have very, very big, very dense keloids, typically you might have to treat them like 6, 7, 8 times even. You can do it every 2 weeks. If you feel like they need a little bit more time in between, you can spread it out and do it every month. And okay, next, before and after photos. Okay, great. So this is again a kinetic facelift, and what you're seeing here is the improvement. I mean, again, look at the vectors. Okay, so you're looking at those vectors and you're seeing how everything looks so much more elevated, right? The canthal line looks higher. The wrinkles look like they're less. Your nasolabial folds are better. The marionette line looks a little bit better. Your jawline looks a bit better. Mind you, the angle is a little bit off in this picture, but just overall, there's nice improvements. Next. And this is even better. So you can really see the changes in that jawline. You can see how much better the cheeks look, right? The cheekbones, they're so much more defined. And again, just looking at the patient, the picture on the right, patient just looks fresher, healthier, right? And that's because, again, these vectors are changed. Next. Yep. And same thing here, you're seeing dermal thickening in this area. So look at the cheek, the skin looks just healthier and younger on the right because you have that collagen synthesis in, and there's just plumpness to the tissue. Same thing here. Wow, this looks fantastic. This is not my patient, but looks really, really good. That jawline looks phenomenal here. And again, look at the nasal. It looks like a different person altogether, but fantastic. The next one, this is acne scarring. This is 2 EnerJet treatments. If this was my patient, of course, you keep going, and every time that you do it, you're going to get more and more improvements because that's what you're doing. You're subsiding. And look at the main area, like the central area. Look at how those depressions have lifted, right? The depressions have lifted because you've gone in there, you've actually done this liquid subcision, and it's lifted up and just overall looks fantastic. But if you keep going with this patient, you'll continue to get improved results. And you know, one thing that I wanted to say is that while this platform is phenomenal and can be used absolutely on its own, I actually do tend to combine platforms very often. So I have a, I have a radiofrequency microneedling device, and sometimes I'll do that. So I'll do, for example, if I'm doing Morpheus on a patient, I'll do Morpheus, and then I'll also combine the Morpheus with EnerJet. So if they have acne scars, I will do the Morpheus just to treat the entire skin very uniformly. And then I go back and I go directly into where those deep acne scars are, and I'll use the EnerJet to subside. Sometimes I combine the Morpheus. Patients come in to me sometimes and they're like, oh, I want to do Morpheus because I want to get a nice lift. And I always tell them, you're not going to get a lift with that. It's a great treatment and it's going to really change the texture of your skin. But why don't we combine it with EnerJet, and that's where you're going to get the lift. So the combination of treatments is amazing. So always keep that in mind too. You may have other platforms, but this is always going to add something more to the platforms that you already have. Okay, next. Yep. There you go. That's another one that looks fantastic too. And you're seeing the texture is completely different in the second picture. Now, mind you, the lighting is also different. So, maybe it's not the best way to judge, but even if the lighting is different, you can still see the changes in the texture. And you can see how those deep indentations are really not as deep anymore in the second picture. Next. All right, and this is a hypertrophic scar. And you can see how well that looks. And this is after 8 EnerJet treatments. Honestly, I've treated patients with similar scars, and I've really only had to do, 3 treatments, and they look as good as this. So fantastic. This is really good. Next. Yep, and this is what a keloid treatment looks like. And that's what it's going to look like after 5 treatments. Sorry, next. And this is a combination of keloids and hypertrophic scars, and that looks fantastic. I can't believe this is after 1 treatment. Wow, very impressive. Also not my patient.
Yeah, Dr. Teny, thank you so much.
Awesome.
That was so amazing and so I appreciate it so much. You were so thorough. I was writing questions down throughout, and then I was like, oh, she answered that one. She answered that. Thank you.
Of
We do
course.
to open up if anyone would like to answer, or not answer, but ask a question. You are welcome to pop it in the chat, or if you want to unmute yourself, you are welcome to do so. While some questions are maybe brewing, or maybe while you're popping that into the chat, Dr. Teny, what is your most popular treatment amongst your patients with the EnerJet?
Repeat that one more time. What's the most popular treatment?
Yeah, that you're using EnerJet for with your patients.
Oh, kinetic facelift would definitely be my most popular one. Although lately, honestly, I've had a lot of patients interested in just scar remodeling, and we're doing great with that too.
Yay.
But the reason why I use the EnerJet for kinetic facelift so much is because when patients come to me for other things, like if they're coming for, like I said, if they're coming for Morpheus treatment, because this is what they've heard about, they come in and I talk to them and I say, you're also going to get so many great benefits from combining the two. So we always end up doing combination treatments, and that just,
Yeah, fits
sells
beautifully.
itself.
Yeah, absolutely. I'm glad you mentioned that, because that was one of my questions, is how are you combining? Because that's really, what it's all about, and how to achieve the best result is just using those different modalities. So I'm so glad you're doing that. How do patients typically respond, whether to, to the treatment and to the results?
Well, they love it. Like I said, usually when I'm doing a kinetic facelift, I always have them sit up when I've done the first treatment. Whenever we're doing it, I have them sit up after I've done just one side, and they can see the difference, and they're honestly floored when they see the difference. Like, oh my God, I totally noticed it. So they love it. And when we bring them back after the first treatment, after the second treatment, after the third treatment, they're like, oh my God, I really, really do start noticing this like pull, and it's lasting so much longer. So yeah, they love it. They love it. We've also, like I said, we have this one patient that we're treating, the one that I showed the picture of. She called us specifically for the EnerJet. She kind of scoped us out. She flies down specifically for the treatment. She comes in the morning, she flies out at night. And she called us the other day. She's like, I've had 2 treatments, and it's just a completely different look altogether. So they're very happy. They're very happy.
That's great. And it's such a unique, device, like you said, and just a unique
Yeah.
mechanism. So every time we talk to people or to patients, are like, what? This is crazy, like too good to be true almost. But yeah, the results are so incredible.
Definitely.
Yay.
Yeah, they're great.
Awesome. Well, if anyone watching this, even in the future, watching the recording, if anyone does have any questions, you are welcome to reach us at the following email that's on the screen. You can find us on social media as well, and we would love to follow you back. Just any info you would like on Sinclair in general, you can shoot it over into that email, or give us a call too, and we'll get you to the right department. Again, Dr. Teny, thank you so much. This was such a great and informative webinar.
My pleasure.
All right. We'll see you next time.
See you next time. Bye.
Bye.